Earlier this year, a document made its rounds on social media that appeared to be from Ontario Health requiring action from primary care providers and incentivizing them to not only promote COVID-19 vaccines, but also to track those who were unvaccinated. We had filed an access to information request to verify its credibility, and this is what came back. Tamara Ugolini here with Rebel News, and before I show you the results of this access to information request, also called an ATIP, let me give you a quick recap. See, originally there was this grainy document being shared on social media, and it had also been emailed to me by others on a few separate occasions. It caught my eye because on closer inspection, the various documents posted online and those sent to me were not identical. The page numbers shown at the bottom differed between certain postings. So it set off red flags. It also appeared to be formatted differently than other Health Ontario memos. And in the interest of credibility, I wanted to make sure that information we were sharing was accurate. So I filed an ATIP to obtain a copy of this letter, or confirm its forgery. You can donate to support these kinds of initiatives and keep our investigations afloat at rebelinvestigates.com. Now I have obtained both pages of this document from the Ministry of Health directly, and this letter is in fact real. As a primary care provider, you are the key to a successful COVID-19 vaccination campaign. You have been selected along 300 physicians in Ontario to receive additional resources and supports for free to contact unvaccinated patients. This initiative from Ontario Health, an agency of the government, can support you in numerous ways listed below. You can decide what will work best for your clinic. It lists the various ways that the government can support physicians, technical support to identify unvaccinated patients using Ontario Health data, patient outreach support and training for staff so you can delegate and automate the process, trained medical student volunteers to help you contact your patients, resources for responding to vaccine-related questions, connecting patients with community ambassadors or trained public health advisors in your community, arranging an online session with you and a group of your unvaccinated patients. Our facilitators can invite patients, prepare materials, and co-host the meeting so you can focus on the discussion with your patients. We are offering a stipend of $150 for your time with this session. You can also bill OHIP $134 with code K082 or group therapy. And then they list that you can contact them via phone or email to get started. And on page 2, it even provides prompts to physicians with responses to general questions like this one. Here they list answers to common questions and concerns. How do I get a full list of unvaccinated patients in my practice? Their practice facilitators can help you or your administrative staff access the list. I have a list of my unvaccinated patients. How do I reconcile it with my EMR? Our practice facilitators can walk you through this process. I don't have time to call my patients. We've developed scripts that your administrative staff can use to call your unvaccinated patients. My staff doesn't have time to call patients. They will provide you with a group of trained medical student volunteers who are ready to help you call your patients. We can also train your administrative staff to use a free robocall platform. And they give some recommendations on messages to use. They also can provide an email template to administrative staff that they can use to engage unvaccinated patients. Of course, they can't work for free. Here are some ways to bill for this work. For a counseling phone call more than 20 minutes, the fee is $67.75 per unit, with the codes listed thereafter. For counseling phone calls under 20 minutes, the fee is $6 with the code to follow. My unvaccinated patients are not interested in being vaccinated. What is the point? Apparently, again, they're using evidence-based approaches, including motivational interviewing and that PROTECT framework to persuade patients who need extra reassurance. And family physicians are crucial to this effort as they remain the most trusted source of health information for their patients. The conversations are tiring and pointless. How can I be more effective? Again, they reference back to that PROTECT framework and giving techniques to help build trust with the patient, offering a compassionate approach to making the right decision. The PROTECT framework is an acronym for the PROTECT Plan. It is a resource for physicians to engage in COVID-19 discussions with their patients. It provides physicians with talking tips, such as outlining why patients are the right person to get the vaccine in an attempt to further coerce patients into getting vaccinated. Ladies and gentlemen, that is our Ontario tax dollars hard at work. For Rebel News, I'm Tamara Ugolini. Filing these kinds of reports is only made possible through the generosity of our donors. To contribute, head on over to rebelinvestigates.com, where you can chip in if you're able, and also check out our previously reported on exclusives. That website again is rebelinvestigates.com.